What's up, everybody? It's Steve the Hurricane here, and for today's episode of A Drink with the Hurricane, we're going to continue our four-part series on getting referrals, and we're going to talk about having a multi-pronged approach towards generating those referrals. Cheers. A Drink with the Hurricane, the home care sales and marketing talk show that discusses all things growing your home care business. All right. I'm enjoying this series. I hope you are too. I haven't done a series in a long time, and I haven't talked about getting referrals in a long time. So it's a beautiful thing from my perspective to be able to do what I love doing the most, right? Today we're going to talk specifically about having a multi-pronged approach, and not just a multi-pronged approach by going into referral sources, but targeting multiple referral source types. When I think about over all the years that I've been in home care, when I used to own my own home care business, before that, when I was a marketing representative for the company I became the VP of, when I joined Senior Bridge after selling Care Choice to them, I started thinking about all of the people that I've come in contact with. And I've met so many marketing representatives up until that point. And I've met so many other home care business owners up until that point. And then now, fast forward the last 8-9 years of my life, I've worked with thousands of home care business owners in 6 different countries around the world and the United States. So I know a thing or two about this. And one of the core mistakes that I see people doing is they have this approach of, I want to get into hospitals and I'm going to hire a person just to focus exclusively on hospitals. And that has got to be one of it's like a cardinal sin, because it takes months and months and years to get into hospitals, to get the amount of referrals needed to significantly impact your business. When you hire somebody just to do that, you're setting that person up for failure, which means that you're destroying their confidence, because you hire this confident marketing person and they think they're going to be able to do it. And then a month, 2 months goes by and they don't have any referrals yet. And now their confidence is shaken. You're wasting money because you're paying this person salary, and if it's a really experienced person, you're paying them a nice salary, which means that you're not getting your return on your investment, so you're bleeding in the time it takes to develop the hospital. And then you have the hospitals, they don't just let anybody in. You can't just walk into a hospital. It's got to be somebody that they know, like, and trust. They got to get the chest X-ray to make sure that they don't have any diseases, and vaccinations and rep track and all these other things. All this stuff costs money too, and time. And then if it's a revolving door and it's changing, you're getting a bad reputation at the same time because you can't keep a marketer. All of these are problems that happen when you go after one referral source type and you don't have a multi-pronged approach. You're just going through the front door. This is where, with Hurricane University, I know I keep talking about Hurricane University because that's where I literally train thousands of people every year. I'm the one who's training you on how to do all this. Having a multi-pronged approach, targeting multiple referral source types. Some referral source types have great patients, but you can develop them faster. An assisted living, for an example, is a great referral source. You're not going to get the volume you can at a hospital, but inside a month, you can start getting referrals from an assisted living. Home health and hospice, for the private duty folks, are great referral sources. You may not get the volume of a hospital, but you might be able to get 2 or 3 patients per month from every home health, every hospice that you're working with. And it takes about 4 to 6 weeks to develop those accounts to get referrals. Skilled nursing facilities, which is my personal favorite. You could have 50 skilled nursing facilities in your service area. They're all not created equal. So some have more of a potential to refer you than others. This is where qualifications come in, and understanding what a target customer, who the home care target customer is, and identifying it, and then figuring out of the 50 skilled nursing facilities in my market, these 7 have the referrals of my target customer that they could send me, where every month I can get 2 to 3 patients a month from that skilled nursing facility. And it takes about 3 months to develop a skilled nursing facility. And so this is where this multi-pronged, diversifying our referral source type really comes into play. Because if I have one hospice, one skilled nursing facility, one home health company, one assisted living community, one continuous care retirement community, all referring me 2 patients a month, 8, 10 new clients a month from 4 or 5 referral sources. And most business owners would be very happy if their reps signed on and started 8 clients a month after a month or 2 on the job. That's very good. That's what our marketing reps and our clients are doing when they work with us. That's very good numbers. And then as you're developing the hospital over 6 months' time, then the hospital gets turned on, and then yes, you'll get your 5 to 10 patients a month from that hospital on top of it. And then your rep, after 6 months' time, is bringing in 16, 20, 25 new patients every single month. It's 150, 200 patients a year. That's what happens when you do the things that we train you in the program and you're following through with this. Multi-pronged approach. You don't just go in one way. You attack every referral source that I just said with 5 or 6 different approaches to get in there. Because if I'm going at it from 4 or 5 different angles, we'll just say 5 or 6 angles, right? 1 or 2 of them is going to get through to get to those key contacts where I can then develop a trust relationship to get that 2 to 3 patients a month referred to me from said referral source. This is the big picture. This is the 3rd lesson in a row, the 3rd week in a row in the series. This probably should have been the first one. I decided to start with social workers because everybody wants to get in with the social workers. But this is how you do it. It's one of the very first things that you do is to determine where am I going to go for business, and then what am I going to do to get into those accounts, and then I start to execute. And when you do it right, when you follow the things that I train you in the Hurricane University program, you're going to get the leverage. You're going to get 4 or 5 places to refer you 2 to 3 times a month, and that's how you're going to significantly grow your business. Now, I love doing this. I have done this thousands of times with home care business owners over the last 8, 9 years of my life. I lived it for 7 years prior. If you want to make 2021 your best year yet, if you want to shatter records, if 2020 left you not so hot and you need to rebound, click the link below. Give us a call. Let us help you blow away the competition.